I'm Charles Strong III of Strong Counseling Solutions LLC. We offer on-site counseling in Gretna, Louisiana, and board-approved online counseling throughout the state of Louisiana. For PLPCs seeking to become licensed, we offer supervision. And for mental health rehabs, we offer services of assessment, psychotherapy, and consulting. So today we're going to be talking about imposter syndrome. And the funny thing about this is that when I started to consider what topics I should talk about in these videos probably 2 years or so ago, imposter syndrome was one of the first things I listed. However, I've never made a video about it until now because of imposter syndrome. It's very common and it afflicts a lot of people in various stages and various domains of their lives, and that doesn't stop short of the professional field, which is where it's mostly noticed. So, what is it? It's a psychology phenomenon in which people are unable to internalize their accomplishments per psychology today. It's important to distinguish that this isn't a disorder, so you're not going to find it in the DSM, which is the book that clinicians use to, that in the ICD-10, they use these books to diagnose what these symptom clusters typically mean and how we label it, so we can start to address challenges. So it's not a disorder, it's a pattern of behavior. So this was coined in 1978 by clinical psychologist Pauline Rose Clance and Suzanne Imes, or Eames, perhaps. It lowers confidence, it makes you feel like a fraud, and you doubt you deserve success. It increases stress, anxiety, shame, and depression. And like I said, it's very common. It affects 70% of people throughout various points in their lives, roughly equal for men and women. It looks like attributing success to luck and good timing. So maybe you'll notice this if you can speak to a group of junior people but not peers, or maybe someone commends you, a friend, on something you're wearing, and you say, oh, this old thing, or something like that. You dismiss it, you poo-poo it away. So Dr. Carol Dweck says that some of the sources might be overpraise of children, which means that there's nowhere left to grow for that child. Absence of mentor or role model and not fitting in are also sources identified by Dr. Dweck. Expert Valerie Young, who wrote The Secret Thoughts of Successful Women, claimed that it might come from environment or institutionalized discrimination. Psychologist Audrey Irvin said that personality traits like anxiety and neuroticism, family or behavioral causes, and childhood memories may be sources for this. Some of the indications are perfectionism, fear of failure, and undermining of your own achievements. So now that you know what it is, when it started to get labeled and identified, where it might come from, what do you do about it? So to combat it, you can voice fears in coaching with a mentor or with a peer group. You can list achievements, skills, and successes in a format similar to journaling. You can have a strong support system, get ongoing feedback, normalize your feelings, tell yourself that there's no shame in asking for help. Praise your effort, so not just the outcome, but the effort. So telling yourself something like you worked hard is very beneficial. And also ask yourself, do these thoughts help or hinder me? So going back to, before we close out today, going back to having a strong support system and getting ongoing feedback, it's important where that feedback comes from. In Psychology Today of January, February 2020, Sophia Caglia talked about a study. There's research on 213 young people in an accounting and finance undergraduate study, and they're asked about perceived social support. Those who indicate support from program peers express fear that others will discover their lack of knowledge or ability. Those who indicate support from family and friends express lower levels of imposter beliefs. And this is believed to mean that and this another study pointed to loved ones, not colleagues, as a potential source for maybe better helping to calibrate a person's perspective, per researcher Richard Gardner. So this is assumed to be due in part to loved ones' tendencies to care for burgeoning professionals unconditionally. So if you just keep in mind those things that we talked about to combat it, you may be able to tackle this imposter syndrome. But journaling is super important to identify that invisible labor and invisible progress that you've made. That's our talk for today. Hope you learned something or found something interesting. You can find more videos like these on Facebook, Instagram, LinkedIn, or Twitter. We'll be back next week with a new video. So until then, thanks and be well.